Welcome to our channel. Today we are dividing into the critical topic of venous cannulation in the cardiac perfusion. Let's break it down step by step. Venous cannulation. What is venous cannulation? Venous cannulation is essential for establishing vascular access in the procedure like cardiopulmonary perfusion and cardiopulmonary bypass or ECMO. It allows deoxygenated blood to be drained from the patient into the extracorporeal circuit. Think of it like a routine for blood while the heart takes a break during surgery. There are two principles: gravity sulfonation and vacuum assisted venous drainage. Gravity works by placing the venous reservoir below the level of the patient. This creates a siphon effect as well. The tubing is full of blood. If there is air in the line, the siphon breaks. This is called a airlock. There is two things: airlock and air embolism. Airlock only occurs in the venous line. The air embolism always occurs in the other parts of the CPV. The factors affecting venous drainage. The efficiency of the drainage depends on the CVP, the central venous pressure, and the height difference between the patient and the reservoir. Resistance in the cannula. Medications, anesthesia, and sympathetic tone can all influence venous compliance, which can cause the vein wall to collapse around the walls because of the cannula. There is a excessive pressure can lead to damaging the posterior wall of the walls of the arteries and the veins. There are types of cannulas. The venous cannula comes with several types: bicaval, single atrial, and cavo-atrial. Proper positioning is absolutely critical for efficient drainage. These cannulas are selected as per the procedures. They typically made of wire reinforced plastic to prevent a kinking, and good venous drainage comes in a straight or angled designs. Although not meant for reuse, coated constraints often leads to sterilized reuse in some centers. Challenges: excessive pressure, excessive drainage. Excessive venous drainage can be problematic. It may cause chattering or flutters of the vein. It will reflect on the venous line. There is a sudden movements in the venous line. It will indicate the excessive pressure in the RI. During the CPB, the right side of the heart will be zero in pressure, but there is excessive pressure. It will reflect on the reflects on the venous line. This is often due to the low intravascular volume or high negative pressure in the vacuum assisted system. In the conclusion, so that you quickly guide to venous cannulation in the cardiac perfusion, whether you are a student, perfectionist, or just curious, understanding these basics can go on a long way in the patient safety and surgical success. Don't forget to like, share, and for more perfusion content. Thank you for watching and stay tuned for more.